we have already discussed, and I have also gave some information regarding CCDC research about more than three non-communicable diseases in one one person. So it is a current ongoing active research method, is being conducted at three places: one in Anakapalli district, two in Gujarat, and three in other country, that is Nepal. Okay, so in these three places now CCDC is conducting this MLTP, MLTP program. Like, it's not program, it is a research method. It is an original research method being conducted by CCDC. So guys, today I just want to give you some insights about CCDC. CCDC has been started, you know, since 25 years. It been completed successfully, and it is successfully running lots of research methods. Okay, so today I just want to share you one thing with you all. Not only that, multiple long term diseases in one person, they in one person, it is the ongoing research. Not only that, they are also conducted lots of research and also published articles at their site CCDC. So their main interest is about non-communicable diseases, especially cardiovascular diseases, vascular diseases, diabetes, mental health. These four are their prime concern. And not only that, they have also implementing national health programs. Okay, they have been collaborated with ICMR and WHO. Okay, so this is the first introduction of the CCDC. So the main backbone of the CCDC is, you know those team members, chairperson, presidents, and lots of people are involved. Okay, and they have they have experience in cardiovascular disease, and their main background is super specialty regarding heart. Okay, like cardiology. Okay, and lots of people related to general medicine, lots of people related to super specialty, mainly in heart conditions, like cardiology department. And not only that, n number of people are being in CCDC, uh, uh, in CCDC. So not only that, in CCDC, like not only that, I want to also share lots of information regarding, like, not only this research, all research methods which are going mainly at institution levels, hospital levels, and all. And not only that, private independent researchers and all. So there are lots of types of researchers, but uh, lots of researches are based on ethical concern and ethical permission, government permissions, and all. And not only that, patient uh, consent and all these things are needed. And in out of all these things, the most simple things are randomized control trials regarding the assessments, clinical examination, and collecting data from the people, which is a research method, original research method, randomized control trials, which does not affect any person in the whole world because it's safe. And in spite of that, they are also offering lots of investigations regarding, you know heart diseases, and not congenital heart diseases, chronic diseases, and all. And they are using the guidelines which are you know uh, PHQ-9 and GARD-7 questionnaires. They are. And not only that, lots of you know useful methodologies they are using to assess the person. Okay, and not only that, they are also providing lots of investigations like LFTs, RFTs, and HB1AC, FBC, like that. They are providing free of cost. So there are lots of benefits this type of research, because one thing, we can assess what's happening in the society and how the person is being affected. So not only that, thereby we can know how the person is living. Okay, see, definitely health systems are being strengthened and has to more strengthened, but if we also cooperate in this type of simple and safe researches and all, it helps the entire world, not only the nation and not only the certain population, because thereby we can get some what is the result of that research, based upon that how to approach the person, not only that how many people are suffering, is there any requirement to develop any new drugs, or is there any causes or reasons are being investigators, those are all helpful to implement the treatment. Okay, not only that, in spite of all these things, they are also offering courses in diet, and not only that, courses in disease healthcare for hypertension and diabetes, and all and they're also offering lots of courses in Southeast Asia and all, and they are also been collaborated with WHO. So it's an international center for you know chronic diseases, and um, uh, so like chronic diseases and all these things, they are have been conducted research on that. So they are very helpful. um, And regarding not only that, I just want to also tell you that simple questionnaires and like lifestyle management, not only lifestyle management, physical activities of the daily activities, daily physical activities, and like mm, not only that, daily physical activities, and you know being assessed, clinical examination, and they can also ask questions about any uh, complaints, or any complaints the person is being suffered and all. So not only that, hi guys, how are you all? Sorry, I'm not able to do live sessions. So sorry for that. Myself, Dr. M. Vijay, how are you all? I'm so happy. I'm just sharing the views with you all. Thank you. And okay, let's go. Let's get into this. And not only that, they are providing what I'm saying is collaborations and all, regarding all these things. They are using all these things, and you know and they are also noticing the increasing other conditions in the same person who is being suffered from diabetes and hypertension. Along with diabetes and hypertension, previously 10 years, 15 years, almost 20 years back, yeah, along with diabetes, along with hypertension, there is one diseases is always along with these two is hypothyroidism. So hypothyroidism now being recognized mostly in pregnant women, and remaining out of people. I mean, remaining all out of people, pregnant women are being recognized by the some people. Some pregnant women are being recognized with the hypothyroidism, reminding there is significantly reducing the number of hypothyroid people who are suffering from hypothyroidism. but according to the new researches and all, and according to new observation and all, and my and all, there is an increase in autoimmune diseases drastically in both women and men. And not only that, along with that, there is significantly increase in arthritis without regarding any age group, regarding any age group of the people, any gender of the people, people are being affected by arthritis. See, before, in previously, osteoarthritis is being, observed, or is being, seen in only oldest people, and osteoarthritis itself is a geriatric disease. It is a geriatric concern. But nowadays, in 25, not even 20, is below 20, not below 20, is below 25, above, in around 25, being observed that osteoarthritis, no, osteoarthritis is being observed in younger people. So autoimmune diseases are increasing. So lots of like that, lots of people are being, single person is being suffered from long term diseases like this. So CCDC is doing good job in this. So why I'm doing, and I have collect all these insights, and I have also intervened, in the sense I didn't disturb any of the member of CCDC while they are doing survey, or while they are taking, while they are conducting survey and all, while they are examining the people, you know I didn't any I didn't interfere anything. If there is any concern about the doctor, or there is an essentiality, or there is any requirement of the doctor, then only we have to intervene in the research, or intervene in the process of collecting data, or clinical examining the patient and all. But out of all these things, what all I can say, that they are doing phenomenal job, and they have collected lots of good, like good information, that see, I can't disclose it, but what their aims and objectives are being, established or executed very nicely, neatly. And I also gave some suggestions, like, is there any essentiality to change, or any essentiality, or like essentiality to implement and all. I also gave some support and all. And not only that, along with me and other medical officer also, they gave their best to conduct the surveys and all, at UPSS PHS level. So what I want to say is, these types of research are really helpful to the people, and these are safer than other research methods, especially regarding drugs and all, newer drugs and all, and treatment interventions and all. Comparatively, these are cool and very helpful research methods. So these type of researchers, if we can support, if we can encourage, we can get better information from the society itself. Thereby we can implement treatment methodologies, intervention methodologies, multidisciplinary approach towards the patient and all. And not only that, implementing newer drugs and all, or there is an essentiality to revise like protocols and all. So all these things. So if we encourage these type of simple research methods, they give the best results, and they give very they give very very important like change in the health department, in the healthcare management and all. So not only that, diabetes, hypertension, and osteoarthritis and all, they have also been focused in endocrinology disorders, obesity, and lots more. And so what all I can say is, so See, we have, obesity is also increasing. The term obesity came. I just want to tell you about each and every person, a male or women. Also, please keep it in your mind. Obesity. In the way you have to manage is, you have to manage the waist to hip ratio. So if you maintain the waist hip ratio of you know 0.8 in female and 0.9 or 1, like 0.9 to 1 in male, it helps. It indicates that your metabolism is good and you are maintaining a good weight and all. Okay. So so the term obesity, we discussed, no, that's why I discussed this. And so if anyone, hi guys, how are you all? Guys, myself, I'm Vijay Durga. Myself, I'm Vijay Durga. Hi, Diksha. Hi, Diksha. How are you? So, if anyone who are in the, today, who are participate in the live session, I just want to tell you about one thing. Statistical analysis is very much important. See, statistical analysis is not, essential in all research methods, but if we do statistical analysis, it adds more significant to the research, because thereby, we can increase the uh, impact of the research and all. So that one thing, any research or any researcher or senior research or like that, it is for students. Please keep it in your mind, the significance of statistical analysis and all. And so that's what today I just want to share. And one more thing, please check CCDC website. In that, one important project has been conducted, and that is about air pollution. Okay, air pollution. Because of air pollution, and in that air pollution, the particles, because of the dust particles, the pancreas are being getting affected, thereby insulin resistance is happening. And because of that air pollution, lots of chronic non-communicable diseases are also occurring. And so not only that, there is a very good research publication is available at CCDC. Please, each and everyone, check out. And not only that, it's been conducted in Delhi and Chennai. So I hope lots of things, I have learned from, this survey which is being conducted at our UPHC. And, lots of things I have learned, I have gathered. And, very, very, I just loved it, you know, participate in research methods, original research methods. And definitely it is an excitement. It wasn't a big excitement, it wasn't big excitement, and still I am feeling that excitement. So anyone, uh, people or students or doctors who participated in this, or who are going to participate in this research and all. So these are the things I just want to share with each and everyone. So thanks a lot, everyone. And uh, and not only that, today I just want to tell you about social responsibility as a, you know uh, as a human being. I just want to share one thing with you all. Please say no to suicide, whatever the circumstances, whatever the reason, or whatever the reason that pulls you down. And please don't take suicide as an option for that any sort of pain. which is being created by anyone. And see, law and order is being strengthened, and we can fight for justice. And please stay strong. See what happened because of meat paper leak and all. Almost more than 20-21 people were died. So because of suicide, still I'm unable to digest. Still I'm unable to digest the thing. Uh, so please don't take the suicide as an option. So please, younger kids or anyone, not only younger kids, adults, please don't take suicide as an option. And I deeply, I deeply sad and deeply felt bad for those child who were died because of meat leak and all. So nothing can be compensated. uh, Loss of life. Okay, no one can compensate for life. you know those are the people uh, take their life, but that is the bad thing. Suicide is the bad thing, that is not an option. But those are the children suffered because of some people or some people's mistake. you know we shouldn't encourage such type of silly mistakes, which led others to die. So compensation with money never get back the life. So those are the children can build a better society, and those are the strength of the society. Those are the backbone of the society. Those are the strength of the nation. Okay, see, those are the people who are offering, or who are you know giving the money, or for the family, those students who died. See, those are the people are living for almost 7 decades, and they know the value of life better than others, better than us. They should think at 18 years of age, each and every politician, where they were and what are they doing. They know the value of life, how much they have earned. Not only money, they earn money, they earn legacy, they earn respect, they earn luxury, what not they have earned all these years. So they know better the value of life, and they should not balance with the money, or 1 crore money, 2 crore money. That doesn't never equal or equivalent to the life of the student. So each and every politician, or responsible persons in the educational system, not only politicians, not only you know lawyers, not only the polices or departments, all education system heads and all, like education boards, NBA, National Board Examinations, NTA, and State Board Examinations, and each and everyone who are in the the position they have achieved is the high position and all. They know the value of life. you know they know the value of life. So they know what they offer, what they are saying for the death of the student. you know they know it very well that it doesn't equal to the life of life of those students. So whatever happened, uh, please keep it in your mind, never let it go off, and never support suicide, or uh, never support suicide. And each and everyone should remember this incident, and make sure that it doesn't happen again. And we should give support, moral support, whatever the support we can give to the student or the person who are in their low time or bad situations, we should give. Okay, not only the family members, not only the parents, any member from the society, or family members, friends and all. So what all I can say is, the precious thing in the whole world is human being life. Okay, still today we can't give the life. If it gone once, we can't get back the dead person back to life. Always keep in mind everyone that. So give value to the life, give value to the human being, and always keep it in your mind. No to suicide. Stay strong, take help, whatever you can do, you do to live. Okay, I always pray for good nation, good society, healthy competition, healthy people. Thanks a lot, everyone.